Sang-Hung Lee is the Director of the Employment and Policy Department of the ILO, which leads the ILO's action for promoting full and productive employment. Mr. Lee has written extensively on economic development and labor issues and has been an active voice and a leading researcher on employment issues globally. Secondly, we'll move to Manuela Tomei. Manuela is the Director of the Conditions of Work and Equality Department of the ILO, which aims to improve the quality of jobs and foster equality for women and men in the world of work. Ms. Tomei has been instrumental in shepherding through the ILO conference two international conventions, the protection of domestic workers and the elimination of violence and harassment at work. And finally, we will have Shara Razadi, who is the Director of the Social Protection Department of the ILO, which promotes policies to extend adequate protection to all members of society, including access to health care and income security. Obviously, an issue that is of paramount importance today. Ms. Razadi has previously the Chief of Research and Data at UN Women and specializing in gender dimensions of social development. Please, everyone, mute your microphones. We have packed agenda, so I'd like to move directly into our presentation segment. Each speaker will have 15 minutes to make their presentation. Slides, documents, and graphs used to refer to this during this presentation are available on the ILO USA website. That is www.ilo.org/Washington. To begin the conversation, I cordially invite my colleague, Mr. Lee, to begin his presentation and provide us with an overview of COVID-19's impact on employment in the world of work. Sang-Hung, the floor is yours. Sang-Hung, I believe you're muted. Could you please unmute your microphone?
My apologies. Actually, thank you, Kevin, and thank you to all participants in Washington, D.C. Andrea, can you pull up the slide, please?
Sure.
Okay, thank you very much again for inviting me to this very exciting and important event. And I was asked to actually brief you about our own evaluation about the current situation and what will be some of the policy responses. Actually, my colleague and Shara will focus on the policy issues. I focus more on the overall situation and impact. Can you move to the next slide, please? Let me say from the very beginning, actually, when we start to see this COVID-19 crisis actually broke out, like in China, the ILO actually start to see that issue from many different perspectives. Of course, there's a very important health crisis, also very important. That has also important implication on the labor market and for the economy. And it is now very clear the COVID-19 is affecting everybody. I think how this COVID virus is affecting the workplace. I just want to show two charts very quickly. This one is we just put together the information of the lockdown in different parts of the world, and then we calculated how many workers are affected by that lockdown. As you can see from the very late actually January, the workers under the either recommended or the mandatory or required workplace closure is increasing. And then when it comes to the late March, as you can see, at least around 80% of the workers are under either recommended or the mandatory workplace closures. And also when you look at the just required or the mandatory workplace closure, we are still talking about half of the workforce here. The recent drop in the mandatory workplace closure is because China started to actually open the factories very recently, but as you can see, the overall trend hasn't changed much. Next slide, please. And another important, Andrea, can you move to the next slide, please? And another issue is this COVID-19 used to be in the advanced countries. Now it's very clear it's spreading to the European countries. As you know very well, European countries, we have lots of the informal workers who do not have any protection in terms of health and also social protection, and these countries do not have a strong fiscal or resource capacity to provide the emergency support for the workers. And this actual chart I put together, again, the lockdown index. The higher index means actually the higher degree or higher intensity of lockdown, and also we actually put that information with the degree, the incidence of informality. And you can see, and that was also rated by the size of the informal workers. As you can see, India and many countries actually the full front of the COVID-19. If you look at India, they are under the full lockdown arrangement, and there we are talking about around between 80 and 90% of workers are informal workers. So you can see the scale of China here. Let's move on next slide, please. So we were aware of all these actual consequences, so we immediately start to estimate what would be the possible impact on the labor market. Andrea, can we move to the next slide, please? So 2 weeks ago, just remember, I'm talking 2 weeks ago. 2 weeks ago, using all available hospital information, we tried to estimate how actually this COVID-19 virus would affect overall employment. In the beginning, we thought it's about 5 million. And then we actually updated the scenario, and then we end up with 25 million. That is our estimation. We actually published it 2 weeks ago. And when we actually published this number, it's already a bit outdated because the number we start to get is much bigger than expected. So I will get into that very shortly. And also, if this actually scenario is correct, we expect huge actual losses in the labor income. Here we are talking about the 3 trillion the US dollars. And this means the workers are actually losing all this actually the income, the labor income, which means less consumption, and also this means actually downward spiral for businesses. So it's very important to prevent actually the income squeeze if we really want to see stronger and faster economic recovery. And when we come to developing countries, last 10 years, we actually observed a steady decline in the working poverty. Actually, at the beginning of this year, we expect another modest decline in working poverty. Now, the situation is completely different. We now predict a significant increase in working poverty, possibly in the range of the 20 million minimum, and probably a bit higher. So of course, I mean, within the workers, I mean, there is so many different situations. Many workers are particularly vulnerable, like the informal workers and youth and young older workers, and also migrant workers. And I mean, you can imagine if all these actual materials, we have to expect a further increase in inequality, which is already high. Let me put these numbers in a bit of a perspective that the previous financial crisis in 2008-2009, in the peak year of the crisis, we estimated that the total unemployment increased by 22 million. So the number of 25 million is higher than 22 million. That's what's given in the US and many parts of the world. People start to compare the current situation to the Great Depression rather than the previous global financial crisis. Another thing is the unemployment is not actually the whole picture. There are increasing incidents of underemployment in terms of the time and in terms of income. And we start to see it. And so that's going to be a bit of the concern right now. And another important concept is that remember, since the 2008 crisis, we have seen quite significant increases in the new forms of employment. Workers, these have not the protection coverage, and also we see that the height of the person do not have much protection either. Another important context I want to mention here is that now as you know very well, there is the strong disillusion with the multilateral system, and we see the strong rise of nationalism. which makes it very, very difficult to deal with this kind of stress. It's actually to restart at borders. So the national economies are now very much interlinked now, but the situation is not necessarily supported at the moment. And as I mentioned, the unemployment estimate is a bit, in our view, a bit underestimated. And I have to draw your attention to the fact that this number is the annual average. So when you look at the short-term impacts, then they must be much worse than the numbers suggest. And also there are lots of incidences of the underemployment, as I mentioned, sick pay, and also the extended short-time work and other work intentions. I mean, there are lots of the actions in the work for various reasons. So in our view, it's very, very important to look at the working hour losses rather than improvement right now, especially in the short term. This is something we're doing it, and so we are going to publish our results next week. But what I can say here is that we are now estimating the working hour losses in the boundary of the 6 to 7% of the total working hours. I don't know how you may not how it means, but if we say 7% of the working hour losses, this can be easily translated 200 million unemployed if we use actually 40 working hours as the threshold for the definition of the sprint. We are now talking about massive losses in the working hours and also employment. Next slide, please. And next slide, please. So in response to these challenges, so I like to put forward the policy framework. I don't want to get into much detail because and also the panel will explain to that. The key point is that we need a very timely and large scale and coordinated policies are needed to protect employment and also help business and support the business. And we need to stimulate the economies to avoid a prolonged economic recession. Particularly, we need to I want to have people in work so they can support themselves. So you can see the 4 pillars there: protecting workers in the workplace, stimulating the economy and the labor demand, and supporting income and employment, and also it all should be done through the strong and very constructive and effective social dialogue. I just want to make some points. Next slide, please. There are some constraints when we're designing these policies, and one is of course there is some two approaches. One is large, simultaneous, and coordinated intervention, or piecemeal approaches. Piecemeal approach was taken in the previous global financial crisis. It didn't work out very well. But in this crisis, we need much stronger, much more coordinated, large intervention. Otherwise, it's very difficult to prevent the huge income and employment losses. And we strongly believe the focus on employment is very, very important. Let's remember, employment and jobs are sources of productivity capacity through skills and experience, as well as the sources of the labor income and consumption. So they are critical in terms of both actually the production and productivity, and also boosting the overall demand. And this actually leads to my next question about the supply and demand side intervention. This time, everybody will agree we need on the same front equally strongly. So one idea would be we can certainly support the business, but with a strong conditions on the employment support measures. Then in this way, the actually public support will actually benefit both the business and the workers. Because this is the long-term actually policy intervention, so we have to create an idea about the short-term and long-term intervention. Provide very strong and near-term measures. This is all about the boosting investment in the end. But we have good news here because we have a number of excellent candidates for the public investment and private and public investment. For example, health, care, and grid, and digital. All of these are recognized in the ILO Centenary Declaration. And I want to highlight as way of the conclusion that the constructive and persistent social science is so essential, both at the enterprise level and also sectoral and national level. If we want to make the result responses effective, they should be built on the trust, and then this trust always requires the consultation, collaboration among social partners. Thank you.
Thank you very much for sharing your data and insights on COVID-19's impact on employment. Clearly, this is a sobering vision of the depth and scope of the virus's impact on the world of work. Really, thank you so much. Before we continue, please, everyone, mute your microphones as respect to all the other speakers and to the participants. If you do not mute your microphone, I'm afraid you will be dropped. Please, if you do not mute your microphone, you will be dropped. At this time now, I ask my colleague Manuela Tomei to provide her insights into the distant work and working time arrangements as COVID-19 response measures. We'll also...
Okay.
Manuela, if you could unmute your microphone, please. The floor is yours.
Yes. Thank you very much. And good afternoon, everyone. It's a pleasure to be here today and look forward towards the discussion. A number of countries across the world are in the process of putting in place measures to protect workers from contagion, from job and income losses, and also to keep business afloat in response to the COVID-19 pandemic. And teleworking and working time-related arrangements, such as short hours work schemes, are among such measures. So in my presentation, I will focus on them, and I will try to highlight what are the conditions, principles that make them as effective as possible in the current trying circumstances. So with millions of people now in lockdown due to COVID-19, more people than ever before are teleworking. That is, using information and communication technology to perform work away from the office. Two considerations are in order. The first one is that not all jobs are compatible with telework, and industries that need workers on site, involving production lines, hospitals, supermarkets, delivery services are excluded from it. And the second important consideration is that teleworking in COVID-19 times is not like working remotely in normal circumstances. During normal times, teleworking is voluntary, is performed by workers 1 or 2 days a week, and is made available to certain employees, usually those with longer tenure. These days, working from home is mandated by government in many countries, occurs on a full-time basis, and concern all or most employees in a company, while people are prevented from going outdoors. In these circumstances, some of the challenges of telework are indeed amplified as the home becomes the workplace, becomes the school, becomes the playground, and all members are indeed forced to 24 cohabitation 7 days a week and often in small spaces. That being said, however, teleworking is practiced correctly can be an important component of the response to COVID-19. But for that to happen, at least 6 conditions in the ILO's opinion, based on our research and policy work, need to be put in place in order for teleworking to be as effective as possible. The first condition is management support, from top management to frontline supervisors. The belief that employees who work away from the management side will not work as hard is still very much entrenched and is an obstacle, of course, to effective practice of teleworking. This is the case of traditional workplaces in which instant bonuses are linked to attendance. So effective management of teleworkers requires shifting towards a results-based management approach in which objectives, tasks, and milestones are identified and monitored in a sensible manner. Because the risk otherwise is that the time spent in participating in long conference calls or in mandatory reporting on daily deliverables taps into the time available to workers to do the work. The second important condition is support systems for mental health and well-being of employees. The risk of social isolation is real with full-time teleworking. Management and staff unions encourage teleworkers to stay connected, supervisors, colleagues, and organizations as a whole. It is equally very important to manage the high levels of teleworkers' anxiety due to worries about the future or about sick relatives and friends while being expected to perform. A decision fatigue may step in. Another issue is domestic violence that may become nastier during lockdown. Anecdotal evidence seems to suggest that this is the case. So some counseling services to provide some support, psychological support, may be in order. The third condition is that expectations need to be clear and realistic. All parties need to be clear about the results that teleworkers are expected to achieve, the conditions of employment, the hours in which workers can be contacted, how to monitor progress and report results. But expectations need to be realistic. Teleworking these days is occurring in a context of schools and day care facility closures, and at the time, as I was saying, of considerable anxiety. It is therefore important to factor in some adjustments to performance targets, especially for those teleworkers with care responsibilities who are mainly women. The fifth condition is, of course, and it's a precondition, I would say, to have appropriate tools and training as well as a safe work environment. This includes appropriate equipment and applications for teleworking, adequate technological support, and training for both managers and teleworkers. By the way, in China, during the COVID-19 crisis, many companies have invested in online office platforms and in related training. Equally important is to have some dedicated workspace free from distraction whenever possible, of course, and to ensure that the workstation is ergonomically sound to prevent any possible health occupational problems. And by the way, there is a recent law which was adopted in Chile, which is quite interesting in teleworking and which is part of the package of responses of the government to the current crisis. The sixth and last condition for effective teleworking in COVID-19 times is for teleworkers to effectively manage the frontier between paid work and personal life. Telework, of course, can offer workers the ability and flexibility to do work at the times that are most convenient, while remaining contactable during the normal business hours of the organization. And this flexibility is absolutely essential in the current context. Certainly, if expectations are clear, this should somehow help in terms of managing the boundaries effectively. But it's important that additional personal strategies are put in place because work from home technology could actually make the overwork culture even more widespread. So it is important to disconnect from work at specified times reserved for rest and personal life. And a number of countries have adopted in the past legislation on the right to disconnect. A number of enterprises during normal circumstances have introduced also measures with a view to ensuring that employees remain indeed not reachable and disconnected for given periods of time. Let me now turn to the other measure that I wanted to talk to you about, which is short work hour scheme. This is a scheme which is being widely used right now in many European countries. There are about 18 European countries, Norway and UK, that have revisited their short work hour schemes with a view to adapting them to the realities of the COVID pandemic. What are short hour schemes? As you know, they entail a reduction in working hours for all employees in a company. These reduction in hours translate typically into reduction in wages that are commensurate with the reduction in the hours of work. And the decline in wages is not always, but in many cases, compensated fully or in part by government-wide subsidies covered either through partial unemployment benefits or by general government revenues. In Germany, just to illustrate the abruptness of the shutdown, 470,000 companies have applied for their staff to join the government-subsidized short-term work program, which is called Kurzarbeit, during the past 2.5 weeks. This is a record monthly increase. And the Ministry of Labour anticipates that indeed there will be many more workers than by the end of the pandemic will have joined this program relative to the 1.4 million people who got wage subsidies under this program at the height of the global financial crisis in May 2009. What are the advantages of short-hour work schemes? These schemes help employers adjust their production to actual demand in the situation of cyclical fluctuations and to retain workers who would then be readily available when the economy recovers. For workers, it means that they would remain in employment, of course, at reduced wages, but this is economically and psychologically much better than being unemployed or on unemployment benefits, if any. And from the state viewpoint, short hour schemes have the advantage, perhaps, of being less expensive than paying unemployment benefits to workers who otherwise would have been made redundant. So what are, very quickly, the conditions that make work-sharing policies more effective for workers, employers, and government? First, it's obvious that the government needs to take an active role in promoting reduced hours scheme, in clarifying what are what's the framework, what are the guiding principles, what are the rules of the game. The second important condition is that work-sharing schemes should be negotiated and implemented through social dialogue at national level and through collective bargaining at the industry level and in specific companies. Just to tell you that all the measures that have been adopted in this area in the European countries I was referring to have indeed done so through a process of negotiation involving workers. The third condition, which is also quite important, is to indeed ensure that the loss in income resulting from a reduction in work wages is somehow compensated with government wage subsidies. And again, I could just, this is particularly important for all workers, but particularly for the low-wage workers. And I could refer to the example, for instance, of Denmark, that just recently has agreed to fund 75% of wages up to 3,000 euros if the company refrains from making workers redundant and employees would retain 100% monthly wages. The other important issue is, of course, that these short hours work programs cover both regular employees as well as employees who are in temporary employment or in contract employment. This is, for instance, the case of the recent innovation which was introduced by the government of the Netherlands, which is indeed extending coverage of wage subsidies to not only regular employees but temporary employers and contract workers. And last but not least, what is really very important is indeed to ensure that there is a proper management and readaptation of the work tasks and work process in the light of the severe decline in the number of hours of work. I will stop here. The only additional point I would like to make is that the way in which we will be able to mitigate the adverse consequences of the pandemic on the health, jobs, and incomes of people and while maintaining enterprises afloat will be extremely important in terms of how ready workers and companies will be to indeed go back on foot when the economy will recover. Thank you very much for your attention.
Well, many thanks for your thought-provoking presentation. Some people have asked about a slides. I'm sure that we can discuss later on if you have some presentations that you'd like to share with our colleagues who are online today. These are obviously fascinating subjects, and we're only just scratching the surface of these topics. To our audiences participating today, please refer to the ILO's website for more information on these issues, which are continuing to be researched and discussed. It's my pleasure to invite Shara Razavi to provide you with an exploration of social protection, what it is, how it helps build resilience in societies, and its importance in helping countries weather not only health crises, but also economic and social shocks. So, Shara, you have the mic.
Thank you very much, Kevin, and thank you very much for this opportunity to be able to have the audience that we have now here, and also to be able to share the panel with my colleagues. I want to pick up on several issues that have already been raised and bring in a social protection perspective. Now, the COVID-19 pandemic, as we all know, it does represent a major public health challenge, so that's one in itself a major challenge, as well as one that is likely to have serious economic and social repercussions, as we saw from some of the figures that Sangon shared earlier. So major disruptions in the world of work, with estimates of unemployment that you saw that are quite shocking. Social protection systems in this context are really an indispensable part of being able to put in place a coordinated policy response to this unfolding crisis, to make sure that people can effectively access healthcare, in itself a very important part of the response, but also able to provide income security at a time when employment challenges are huge. Now, evidence from previous crises, of course, shows that countries that have effective health and social protection systems in place that provide universal coverage are in a much better place to be able to respond to the immediate shocks of a crisis of this nature. They have the institutional capacities to scale these systems up relatively quickly, rather than having to develop policies and interventions in an ad hoc way under very difficult circumstances, and also with a time lag. So when you have those systems already in place, that's why we call them automatic stabilizers, because also by putting in place those income support measures, it's also very important because it helps aggregate in a strong way. It boosts aggregate demand in a context where we know that economies are in decline and are facing a recession. So they can also play, not only do they respond to the immediate needs, income needs and health needs of people who are affected, but also at an aggregate level, they can also contribute to a kind of counter-cyclical macroeconomic policy framework, which is badly needed in the context of an economic recession. Now, as you can see from the only figure I'm going to show, and I'll be grateful if Andrea can share that figure. As you can see from this figure, in fact, national social protection responses to the COVID-19 crisis have already kicked in many countries around the world to address many of the challenges that are being faced. The ILO Social Protection Monitor, which is where this data is coming from, tracks announcements of social protection measures through a systematic analysis of media news published online. And in the period between 1st of February and 22nd of March, which this data refers to, it recorded 97 social protection measures that were taken in 46 different countries. And of course, the real measures that are being taken may be even bigger than this, the numbers that we have here, because these are the ones that are available online and the ones that our country teams have informed us about. Now, these measures address several areas of social protection. You wouldn't be surprised to see that nearly 1/5 of these responses are related to health, closely followed by unemployment benefits. Also, we see new and increased social transfers to low-income families, which have also been widely adopted in about nearly 20% of countries, followed by adjustments to pensions and also sickness leave or sickness benefits that have been put in place. So let me say a few words about some of these measures that are being adopted and putting these alongside the significant gaps that already existed in social protection systems around the world. So I'll just have 6 points that I want to make, and I hope that I can do it within the time that I have. First, in many countries, we see that they've taken measures to enhance access to affordable health care. And to put this in perspective, let's remind ourselves that nearly 40% of the world's population had no access to health insurance or access to national health services. In other words, for 40% of the world's population, they had to resort to out-of-pocket payments. So this was the context prior to the crisis. So with this crisis, the measures governments have taken are, I'll just give a few examples. They've channeled additional fiscal resources into health systems in many countries to make services more widely available. They've improved coordination in their health systems, sometimes by giving a much stronger role to the public provision of healthcare, as in the case of Spain, sometimes complemented by private service providers under public regulation. Several countries, including China, have increased integrated prevention measures, testing and treatment as part of their healthcare benefit packages. Also, we see enhancing financial protection against healthcare expenses, ensuring universality of coverage, particularly for some groups who are usually left out. In Thailand, for example, is guaranteeing treatment for foreign residents as part of its healthcare response. A second area of response is countries are taking measures to enhance income security for workers who are sick. Now, I think the COVID-19 crisis was very very instrumental in exposing critical gaps in the provision of sickness benefit coverage, especially when it comes to workers who work in the informal economy, who have no access to sickness benefit or paid sick leave. Again, I think it's worth reminding ourselves that even, that prior to this crisis, in less than 2/3 of all countries, there was a social insurance or social assistance scheme in place that provided sickness benefits. And therefore, those who were ill were often forced they would have to work if they wanted to pay their bills, and thereby endangering their own personal health as well as public health. So this was a kind of difficult choice that they had to make. Now, addressing this gap is particularly urgent since it affects many workers in the front lines of the COVID crisis, such as health workers, domestic workers, cleaners, transport and delivery workers, for many of these workers, having sick leave is obviously essential, as it is for all other workers. Now, in this context, governments are again taking a number of measures, are putting a number of measures in place. We see extension of sickness benefits that are being financed from general taxation to workers who were not otherwise entitled to such measures in several European countries, including Germany, Ireland, Portugal. Also, there has been the ensuring of payment of sickness benefits in cases of quarantine or self-isolation in several European countries, but also in Vietnam, for example. Also, several countries have eliminated waiting periods for the payment of sickness benefits, and also they have waived requirements of having to send a sickness certificate, for example, in Austria and Japan. Now, a third cluster of measures that are important, and this relates to some of what Manuela was just saying, are the way in which countries are responding very strongly to labor market challenges by preventing job losses and responding to those who have already lost their jobs. And again, I think I want to put this in perspective by saying that unemployment protection prior to this crisis was severely inadequate, despite the critical role that it plays in supporting household incomes and stabilizing aggregate demand. As Saigon already showed, hundreds of thousands of jobs are now in peril, and yet only 1 in 5 unemployed persons worldwide can count on an unemployment benefit, i.e. 20% of those who are unemployed can count on an unemployment benefit. Now, to address this major deficit, governments are taking a number of measures. Many are supporting companies to retain workers through short-hour work. This is what Manuela was referring to as the Kurzarbeit, as in the case of Germany, and or by providing benefits and partial unemployment benefits. Germany is a typical example, Denmark, France, also again Japan, and several US states, the US state, California in the US, and Thailand. Also, countries are facilitating access to unemployment benefits for workers who have lost their jobs. And this is again the case in several countries, and also providing one-off emergency payments to laid-off workers who are not otherwise eligible for unemployment insurance, this being the case in Australia, Italy, and Japan. Now, a fourth set of measures is in terms of addressing the particular vulnerability of older persons and persons with disabilities, as we know, who are particularly vulnerable to this particular disease and at risk of serious health consequences and serious health expenses. So many countries have tried to increase old age survivor and disability benefits because of the role it plays in ensuring income security for those who are particularly being affected in the current moment. So measures governments have taken include advancing the payment of old age and disability benefits or increasing the level of the benefits. Argentina and Peru are good examples. Ensuring continued access to disability benefits and also care and support for persons with disabilities, and also minimizing the risk of contamination for older persons when they go to collect their pension at pension pay points by trying to use other forms of payment that don't require the person to be present to collect a check. Fifth area is quite important is, given the deepening economic consequences of the crisis, many governments are expanding social assistance and other tax-financed cash transfers and in-kind benefits to the wider population. So social assistance, for example, is being scaled up by advancing payments of benefits or increasing the level of benefits. Malaysia, China, Brazil are examples that come to mind. Relaxing eligibility criteria to increase coverage, for example, adapting the modalities or conditions of social assistance schemes with regard to, for example, where they have conditionalities that people have to show that they're searching for a job. So those kind of things are being removed to make access more easy and available for a larger number of people, and also generalized income support to all residents through one-off payments. Also, many countries are providing in-kind benefits such as food items, which are obviously going to become increasingly important also as the crisis unfolds in countries where food security is a real challenge for large segments of the population. So providing, for example, meals to children who are no longer able to go to school and access school meals as part of their daily routine in the past. And also some countries are extending cash benefits, particularly to people, vulnerable populations like, for example, homeless persons. And a final area that I want to touch on before saying a few concluding remarks is action with regard to paid leave to care for children and other family members. Now, with the closure of schools, universities, and childcare services in more than 100 countries, which are impacting about 800 million children, according to UNESCO's data, family leave policies have really moved to the center of attention. And this may include introducing or expanding special family leave to support working parents who are affected by the closure of schools, also providing childcare facilities for children of workers, frontline care workers in particular, who, like healthcare workers, who are still working. Countries like Netherlands, France, Austria have put in place these kind of care facilities specifically in this context for parents who are in the labor force and in providing essential services by having to be present on the job and not being able to telework. Also supporting those who provide long-term care services for older family members. Now, all of these measures clearly are addressing some of the serious gaps in social protection systems around the world at a time of growing need for affordable health care and severe income insecurity due to sickness, unemployment, etc. As it stands, we know that 55% prior to this crisis, 55% of the world's population, which is about 4 billion people, could not benefit from any form of social protection whatsoever, with many countries relying on market-based solutions, which of course only those who can afford can really access to sort of be able to fill those gaps. So I think the COVID-19 pandemic is starkly demonstrating that having these gaps is not only bad for those people who are excluded, the poor, etc., but also it really threatens the well-being of entire societies and of entire economies and the global economy. So I think it's really a call for action. After the last global crisis in 2008, the international community took a major step by unanimously adopting the ILO Social Protection Board recommendation, which really helped increase government commitment to establishing minimum levels of protection that would form the basis of a comprehensive social security system. But unfortunately, as the current crisis makes it clear, not nearly enough progress was made in the past 12 years. And if this pandemic has a silver lining, one hopes that it spurs governments to expand access to health services to really make that universal by beefing up and strengthening public health service provisioning and by providing sickness benefits and unemployment protection to everyone so that it can really kick in automatically when we are faced with these kind of shocks. After all, evidence shows that such spending has also a large positive multiplier effect on the economy and can also help support social and political stability at these difficult moments. Now, ILO estimates show that for developing countries, the average financing gap for implementing an adequate social protection core is about 1.6% of the national GDP. For very low-income countries, that gap is much larger, around 5.6% of GDP, which clearly means that they would need global support, to be able to expand their fiscal space. Yet we also know, and this crisis also really makes that clear, that the world has never been as wealthy as it is today. Now, whether it's pandemic-induced a recession or not, we can mobilize the necessary resources, and I hope that the mobilization that we're seeing at the moment is showing that we can. Many of the measures needed to mobilize these resources, such as, for example, expanding and strengthening domestic and global taxes, would take time, and this is time that we currently don't have in the context of the present pandemic, which is already disrupting economic activity and decimating incomes and demand. So therefore, speed is really crucial, and in the short term, we really need to have more flexibility for deficit financing, and this is something that the IFIs are taking major steps forward, as are many G20 governments. And we need concessional international borrowing to support investments in social protection systems for many developing countries. As Mariana Mazzucato put it in a recent article that she had in The Guardian a few days ago, governments must really make sure that we don't let this crisis go to waste. We need governments and the global community to use the momentum that is created by the current crisis to make progress, rapid progress towards collectively financed, comprehensive and universal social protection systems. Only then will our societies and economies be able to weather the COVID-19 pandemic, but also the many crises that we know will come in one form or another in the future. We need to be much better prepared for that, and I hope this crisis will help us mobilize for it and move forward. Thank you very much.
Thank you very much. I really appreciate your ability to convey a very complex concept such as social protection in such a brief time frame. For the ILO and the international community, social protection is a human right that plays a key role in achieving sustainable development and promoting social justice. Before we move to a Q&A session, I'd like to ask the speakers, and I'll start with the top of our speakers, with Sang-Hong, one last point. If you can just sort of provide us with maybe just a 2-minute sort of intervention on a final point that you really want to leave with our viewers today. So Sang-Hong, Manuela, and Shara, if you could just give us one of your sort of very brief Sang-Hong, the floor is yours.
Thank you. I want to say something about the policy measures. Right now, as you know very well, the situation is very sort of devastating, and when it comes to what actually workers and the business enterprise can do about this, there's not much in a sense. So this is really time for the very proactive government measures which make sure the good enterprises and the very productive enterprise survive. At the same time, the workers actually can manage to maintain their jobs, and also in that process, and we are actually kind of creating a momentum for the fast and the job actually led recovery. And there, I think the government shouldn't be too shy away from taking immediate and large-scale interventions, mobilizing all necessary resources if needed through even the short-term debt to provide all the support. I mean, if you consider the cost of doing nothing and also the cost of doing something to help business and workers, in my view, the cost of doing nothing is far greater than doing actually something for workers and business. So I think this is really another time to actually somehow to be a bit of the prudent, if you like, actually on when it comes to fiscal expenditure. And actually, our colleague Shara mentioned about the social protection. Social protection is one of the best tools we have. They are doing their best, but that's not enough. We need to find a way of supporting social protection system, channeling more resources to the system. And if we don't have the social protection system in place, we can find some other channels which is a bit similar to social protection in terms of function and also in terms of effect. We can be very creative there as well. Cash transfer is one idea, conditional, unconditional. There are so many ways of doing that. I don't think we are not short of the tools and the programs and measures. What we need is very much stronger political will and also our will to mobilize all the resources at our disposal. Thank you.
Manuela, you want to respond for 2 minutes?
Yes, can you hear me?
Yes, we can hear you loud and clear. Please proceed.
Okay. Well, I think that what is coming out very, very clearly also from the interventions of both Sang-Yeon and Shara is that the time has arrived for thinking and acting big. There is no longer room for band-aid type of solution. And I think Sang-Yeon alluded to that, saying that we should refrain and shift away from piecemeal approaches and move towards more integrated policy responses. And again, our interventions, I think, somehow show the need for thinking in a more integrated manner. Another important reflection is, and this is what Shara said, regarding the fact that now there is a realization in many countries that those workers that have been somehow left behind and outside the coverage of social protection, but that perform a very important and provide very crucial services to society, such as care work, are indeed the ones that are now getting some attention from most European countries. I think that one of the major changes that I can see in the response to the COVID pandemic relative to the Great Recession of 2009 is indeed the recognition that there are certain workers and large groups of workers that are particularly vulnerable and that are in need of a strong support with a view to ensuring that indeed the society and economy can go on their foot. And last point, I think, is and this was very well evidenced by all the presentations, that indeed there is not a blueprint approach, that the responses need to be adapted to the very specific circumstances of developing countries, industrialized countries. In all instances, there is a need for thinking of how to ensure that social dialogue is not left behind, that institutions and labor market institutions are properly strengthened, and that we are indeed operating within a rights-based framework. Thank you.
Thank you, Manuela. Shara?
Yes, I think what I want to say follows nicely from what Manuela was just saying. I think this crisis in a way has, and the pandemic in a way has made it very clear that our societies are as secure as those who are least protected. I mean, this idea that we can have these islands, onto ourselves, is really, I think, has been proven to be a myth. We are incredibly connected in the societies that we live in. And this disease was, I think, a metaphor of showing you cannot have islands of opulence and security in the midst of large numbers of people being excluded and deprived of their rights. For me, that's kind of one of the strong sort of messages that has come out of this crisis. The real need for universal systems and why universality and why we're so connected within our countries, but also I think given the way in which the disease has gone from one country to another, it has also made clear the need and the connectivity, global connectivity, but also the need for global solidarity. Because having deprivation of rights, having, in this context we see it with disease, but it's evident in other ways as well. When there is exclusion and there is deprivation in one part of the world, it does affect the other parts. We are connected, and the need for universal systems and the need for solidarity, including financial solidarity, in building systems that keep everyone secure is to everyone's benefit. You cannot have a secure world when there are large numbers of people who are deprived and insecure. And for me, I think this is one of the main messages that this COVID-19 crisis has really sent loud and clear. We cannot pretend as if we're not connected. We are connected, and the systems we still need to be inclusive. Thank you.
Well, there you have it, folks. I mean, there's some wonderful statements, not only just about the numbers and the kind of the more distant sort of elements of sort of the estimates, but also very specific down to what it means to people, how we're going to be interacting and operating, what it means to society, and also what are the measures that are being taken just to let you know that the ILO is currently collecting information from around the globe about responses that governments and our social partners, the workers and employers are taking in order to address the COVID-19 situation to obviously mitigate the worst circumstances for that. So please stay tuned for that on the ILO's COVID-19 portal. That should be up sometime next week. At this time, I just want to say really again, thank you to all the speakers for the presentations and for everybody being here with us today. At this point in our program, we are going to be moving on to a Q&A session. People have been sending some questions in to me. So what I'd like to do is I'd like to read out 3 questions for our panelists to respond to. Those who have additional questions, please send to me. I'll try to do as best I can to cover all of those. I think one of the first questions I have for our panelists is in terms of the new estimates that are coming out. Sang-Hong, you talked a bit about what's coming out. It would be good to understand, is it updating the entire publication of the original report that the ILO came out? Is it just the new numbers? Additionally, will those numbers be disaggregated by regions or sub-regions or by gender? And also if there's any other information that we should know about. That's the first question. The second question I'd like to pose to the panel is that there's concern about arising in terms of the workers who are being left behind. What is being done at the ILO's level? Are we looking at developing a fund to help these workers that are being left behind? We look at the garment industry, for example, where many of the outlets are closed. People can't go buy the clothes except for online. Lots of orders are being canceled. It's going to directly lead to millions of workers in the garment sector and elsewhere losing work because of the pandemic. So are there examples of others of work that the ILO is doing or the World Bank is doing or IFC that we can reflect upon? And then the third question that I'd like you to look at is that in terms of the millennial generation, Generation Z, I mean, there's enough nervousness and anxiousness among the younger generation about their future of work and, of course, the mounting debt from college as well as the legacy from the Great Recession. What does the future of work look like for these generations, and how will COVID-19 or other pandemics that may come about impact upon that? So with those 3 questions, I would ask our colleagues to respond. I leave it to you to decide. Please, you can leave your microphones open if you'd like to join one another. So with that, please, the speakers, it's yours.
Okay, then let me respond to the first question about the forthcoming updates to the ILO note on the COVID-19 impact. What we did in the second note was that to look at what will be the range of the average, the annual unemployment. So the number we put out, the 25 million, is our expected annual average of unemployment for 2020 whole year. When we do that, we actually already specified the possible range of this estimate because we have upper bound like a 35 million and the lower bound is 15 million in our estimation. And then what we start to see is that the short-term responses to this COVID-19 and also the economic slowdown immediately, employment actually responded so quickly and with a very large magnitude, which is much quicker and much larger than expected. For example, you saw the recent numbers actually from the United States. I mean, the job was claimed actually dropped like by 3.3 million. And we see the similar situation in the most of the European countries. So that's why we just want to monitor what happened in short term or quarterly basis on this established claim. Another important thing is having a job in this context does not actually fully explain your situation. For example, you're keeping the job, but your earnings is falling, your working hours is shorter. You end up with a very, very short hours, but you are still recognized as an employee. That really does not capture the real situation. So that's why we are looking at the working hours side and how things are moving. So in the next update, we are going to report on how much losses we have seen, what we expect for the second quarter in terms of the working hours, and then we are trying to estimate that we are actually using that as the basis for our overall prediction on the overall unemployment. Of course, we are now looking for more the upper bound of our estimate, which means moving away from 25 million towards more than 35 million at the moment. That's all I have. And Manuela?
Manuela, you'll have to unmute your microphone, please.
Well,
Still muted, thank you.
sorry.
You've remuted yourself. Just push it one more time, and
Can you hear me
there you
now?
go.
Okay.
You're good.
Yes, I wanted to respond perhaps to the question related to what the ILO is doing in terms of avoiding that groups in vulnerable situations are further left behind. And during or as a result of the COVID pandemic, you make reference to workers in the garment sector and whether the ILO was envisaging any action with a view to containing the dramatic loss in jobs and incomes in that sector, particularly in developing countries, as well as the closure of manufacturers and suppliers of there is, the ILO is right now consulting and coordinating with our constituents, with industry and our community, industry partners and the donor community, to try to devise a solution that might indeed respond to this very serious and abrupt loss in jobs and income. Which has made clear the need for indeed investing in countries in which protection takes place, in stronger social protection schemes. At the same time, the need for perhaps also with some support from the donor community to provide assistance with a view to ensuring that businesses will be able to go back in business and workers will be supported while this happens through income support. There are many other groups that we deal with. One is also people with disabilities. They right now we are as the rest of the UN system in the process of putting in place an inclusion strategy of people with disabilities that requires a number of adjustments in our operations, in our priorities, also at the country level. And I think there was also Shara that alluded earlier on how also the ILO social protection perspective is trying to address the of people with disabilities that particularly important because indeed they need some additional support due to their disability, and also they are overrepresented among the unemployed, and therefore support in terms of income is absolutely essential. Thank you.
Sarah, can we have your feedback on any of those questions, please? All right, you're muted. If you're going to respond, please unmute. No response at this time. So maybe what we can do is go to a second round of questions, and please keep those questions coming in. One of the questions that's come in is sort of looking at telework, or as we call it, distant work today. There is a risk of detachment from the company. Should we be fearing large-scale movements towards teleworking or distance working? How is that going to impact upon the employment relationship? And will it push companies more towards outsourcing? And then tangent to that question is, what happens to those line workers, the production workers? They unfortunately can't telework, or at least not now, maybe with development of machinery it can. The second question is on social protection, including cash transfers, employment subsidies, unemployment benefits. How is the ILO and the international community coordinating its policy responses with governments, particularly in low-income countries where they actually start with a very low and limited resource base? The third question I'd like to ask is to talk about the hourly workers on the front line. So we've seen that some of the professions are necessary. So sanitation, healthcare, maybe even supply chain operators, service industry jobs. We do have the police and the firemen and other workers, grocery stores. How can we continue to support these people in the midst of the pandemic? We're putting their lives at risk. And what steps can be taken to ensure that these workers who have faced this crisis will be also looked after when the crisis subsides? If I could ask my colleagues to respond, please.
Sorry, maybe I'll just come in on the cash transfer point. So, yeah, I think that's a really important question. In many low-income countries where you don't have already significant numbers of workers who are part of the social security system, obviously many would resort in this time to social assistance, cash transfers. I think that question of conditionality is not really one that is relevant at this point, because governments are trying to roll out cash transfers, as fast as they can. ILO has a global technical team of social protection experts who are working very closely with governments in the countries where we have presences, as well as from our regional offices, and providing both kind of the normative functions, the normative guidelines in terms of how social assistance measures can be put in place, as well as trying to bring and work with countries where there is development cooperation, there is financing from development cooperation donors available. So there is a kind of infrastructure, if you like, of people, of social protection experts who are present in the countries, working with the government as well as the development cooperation experts. And the demands on them are huge at this time in terms of giving technical advice, in terms of design of schemes, how to make sure also that the delivery happens, the mechanisms are put in place. And there is quite a lot of coordination there happening between the global technical team and experts at the headquarter level who do some of that technical backstopping. And there is a big question around the fiscal gaps that I mentioned that exist, and they're still there. And we do hope that this crisis will also enable a bigger conversation around how that fiscal gap can be addressed. And I think we need to be thinking now about the big numbers that are needed to really make that demand for a global financing facility a reality. And we hope that there can be strong conversations with countries, with developed countries, the G20 countries, about possibilities of really getting financing into a global financing facility that would help build the social protection systems and roll out the kind of transfers that are needed in developing countries.
Can I step in to respond to the questions relating to teleworking? We are talking of teleworking which occurs within an employment relationship. There has been actually a wave of legislative reforms in many countries that precede the COVID-19 pandemic, which were aimed at encouraging, including in the United States, which were aimed at encouraging workers, those, I repeat, that indeed work in occupations and sectors which are compatible with telework. Not all occupations are compatible with it, so this is a point to be borne in mind. To indeed resort for limited periods of time to working away from the office. So this does not mean that a dilution of the employment relationship, but rather envisaging a different way of organizing work which indeed is made possible by information technology. This is why it's indeed the main driver behind the promotion of teleworking within employment relations was driven by a number of considerations, the fact of indeed being able to reconcile work and life, the need for reducing the time spent in commuting, reduce the traffic jams. In the case of Japan, the main to try to counter the demographics and the decline in the supply of labor and the availability of workers, especially women workers who are educated, etc., to engage in the labor market because of the lack of family-friendly work policies. So teleworking is not to be seen and it's not conceived as a means to reduce the employment relationship and obligations that exist and rights that exist within an employment relationship. But that's why it's very important to be mindful of how to ensure that teleworking becomes an experience which is a positive experience both for the worker as well as for the organization, for the company. And this is why, the conditions that would indeed translate into those positive outcomes that I mentioned earlier on, with some adjustments, given the fact that now, with the pandemic, people are teleworking on a full-time basis. And it is very, very challenging for many reasons, including the whole idea of how to ensure that the division between hours devoted to work and hours devoted to personal life are kept under control. Perhaps very quickly on the other question relating to how to ensure that the frontline workers are indeed so in navigating the pandemic, and that are so vulnerable and such a situation of disadvantage. I mean, what are the lessons that we can draw? How to assist them in right now, and how to ensure that we draw some lessons in order to inform better policies to afford them adequate protection. Well, first thing, as you were saying, it's very important indeed that they can have access to hand sanitizer, to masks, ensure that there is proper social distancing, etc. Another sort of obvious issue is to provide them with some hazard pay. Some income, some support during the crisis, and this leads me to the sort of more long-term consideration, which is that the importance of unionization. I mean, these are workers that indeed lack voice, that indeed very often are not organized, and therefore have difficulties in indeed negotiating perhaps a hazard pay, negotiating proper equipment to protect themselves from the disease, from the virus, in order to be able to continue to serve all those who can work from home, all of us who are indeed quite privileged. And the third point I would like to make is that perhaps we should indeed rethink the way in which we have been regulating labor and social protection for workers, including for these workers. There has been really a sort of regulation on the margin. I think that it's very evident that this is not paying off, has only exposed the vulnerability of the system, and therefore, this is really an area which would deserve greater attention, and see how we can afford to all workers, irrespective of their contractual status, proper fundamental protection when it comes to working conditions, when it comes to occupational safety and health, and when it comes to social protection. Thank you.
Okay. Can I mention a couple of things? Actually, The first one is about the health workers. I mean, there are real concern about the health and safety of our health workers, and they are really on the front line at the moment. I also want to draw your attention to the fact that actually, globally speaking, we have a serious shortage of the healthcare workers at the moment. The actually previous estimate done by China's department basically indicating we are now 11.1 million shortage actually in universal the health workers to provide different level of the healthcare for all. So this is something we have to really seriously consider, and probably we have to consider that as the main area for the public investment in the coming years. Second point is that this crisis is different in many respects. In one particular way, because now all of this a little difficult situation in the economy and the labor market has much to do with the actions the society decides to take in order to protect us against the risk of the COVID-19. So it's, in a sense, you can say it's human-made. We take actions for the public purposes, and they have impact on the workers and their families. So which means we have very good active reason. We have to provide all necessary support to those people who are affected by the very actions the society has taken to protect the society. So which means we have to pay more attention to, for example, self-employed and also the non-standard workers, irregular workers. They are hit very severely by this actually social disease. So we have to give a real priority. It's not about the financial crisis. It's really the crisis for ordinary people. That's important. So my final point is that we keep talking about physical distancing. But physical distancing is only only the people who can afford to do it. But there are many workers who actually make this actual physical distancing happen. So there are lots of delivery services and linked to the platform workers. There are lots of people still cleaning service. They are still working there. They are also exposed to this COVID-19 the risk. So I think in my view, it's really social responsibility to give the top priority in terms of providing all necessary support, income-wise, or the facilities or equipment to them to make sure they are well protected, because they are the ones who are actually making us actually surviving in this difficult time. Thank you.
Yes,
Kevin, just comment very quickly. Yeah, I mean, I think just to build on what Manuela and Sangon have said, I think this crisis has really, again, reinforced, I think we could worry about particular industries, the garment industry, others that are very much affected, and there are, some solutions that trade unions and others are discussing now, so I think that's great. But really, I think we need to be thinking about sort of the idea that I think in many ways animated the ILO recommendation 202 after the discussions that began with the global financial crisis and then led to that recommendation, which was this kind of idea of universality and the need to include, we've talked about workers, formal workers, but also a lot of the workers who are self-employed, informal self-employed, who are not registered, who even in countries where where the self-employed have registered but not made contributions, the fact that they're registered makes it easier to roll out cash transfers to them through the social security system. Whereas when you don't even have that kind of registration, then, you're in many ways invisible. So I think this important role of expanding social security and social protection to all kinds of work and workers in all kinds of situations, that's really, I think, coming very clear, and making sure that you have different kinds of protections, unemployment, sickness leave, family leave. These are all issues that I think this crisis has brought out very clearly, the deficiencies that we have in our system. And the need, I think what Sangon said is absolutely critical, again, at how we have deprived and underinvested in what now we see as really essential services. These frontline service providers, our healthcare services, have been incredibly understaffed and under-resourced. And again, as you know, hopefully if there's a silver lining to this crisis, is that it will remind us of what it is important to invest in and what kind of workers really need to be protected. And care workers are among those who have, as evidence showed, been regulated, underpaid, and I hope that our investment strategies will be sort of rejigged and really rethought in the light of this crisis, so that we put our public resources where we really need it, and not let such essential services be so underdeprived and underinvested in.
Thank you so much. We've had so many more questions, but if I could just ask everyone to bear with us, I just want to have 3 quick questions, and if I can have our experts just respond back in 2 minutes, no less, then I'd like to move on very quickly to the next steps. We have so much ground to cover, and I think we could do this for hours. But just very quickly to my colleagues there, a few questions. One in terms of the kind of social protection side. How are we balancing, the cash transfers versus the employment subsidy, unemployment insurance? What is most effective, and where should the focus be in low-income countries? The second set of questions will be on migrant workers. This crisis is impacting upon everyone, but the millions of people who are on the move working in third countries who can't go back home, that the families and the communities that rely upon their remittance payments, that they are stuck and the monies are not coming and they may fall into destitution. How can we actually help? Can civil society organizations on the ground help provide that? Is the ILO providing any idea about how they should move forward? And then lastly, I would just like to talk about the issue of social dialogue, which for the ILO means communication of any form between workers and employers. I mean, this is absolutely essential to having a voice of a worker if we want to ensure that those who are most vulnerable and those who are the most essential, because the ones who are the least paid are the ones who are on the front line. So how are we going to encourage businesses to be receptive to the idea about listening to the voice of the workers, which sometimes seems anathema to them, but I do believe that businesses are realizing that people are looking at them. They want to make sure that the companies that they want to work for, the talent that may go to those companies, want to be proud of the companies they work for. How can social dialogue, this idea about we're in it together, how do we work together to create more income opportunity for people, whether it's at the high level of the white-collar workers or those who are most susceptible to being let go? So if I could just have a 2-minute response from our experts, and then we'll just move to a wrap-up. Sarah, would you like to speak about the other time?
I think Manila is a much better place to answer all these questions, because social dialogue, a good example, is from Italy. So I think I leave the time. I am giving my time to Manila.
And Lila, you're on the spot.
Yeah, I wanted to address a very important question relating to migrant workers. Indeed, they are the last to be tested, the last to be taken into account in addressing the sort of immediate needs and mitigating the impact of COVID-19. In many instances, they have been dismissed, and at the same time, they are prevented from flying back or going back to their countries of origin, because these countries have indeed shut down and closed their frontiers. So it's really a dramatic situation that migrant workers are facing across the world. We are trying in the ILO, also together with other UN organizations that make part of the UN network on global migration, to indeed try to ensure that policymakers pay some attention to the very specific and very worrisome circumstances of migrant workers. But I would like to say that despite the amount of very worrisome news that arrive from all over the world in terms of how desperate the present circumstances are, there are also some countries that have taken important measures to try to alleviate and to mitigate the effect of the pandemic on them. And I would like to quote, to cite the case of Portugal, a country which has just 2 days ago decided to indeed regularize all the requests on a temporary basis, all the requests for residence by migrants, with a view to enabling them to have access to health services. So what we are trying to do in the ILO is to try to shed the light on the trying circumstances of these workers, trying to network with other agencies and with our constituents with a view to devising some concrete policy responses, and trying also to showcase the good practices, because there are quite a number.
Thank you very much, Manuela. Shara, do you have a last word to our audience here before we wrap up?
Sorry, I can just maybe very briefly say that on the type of sort of responses that countries are using, I mean, again, country circumstances are very diverse. I mean, countries that have more extensive social security systems with reserves can draw on that to expand, increase the sort of unemployment benefits. As your example cited was saying, you can increase the benefits that are already in place through the social security system. Many poorer countries, of course, don't have social security systems with reserves that cover a significant part of the population. In those contexts, general public revenue from taxes, from concessional lending, from international aid will have to help finance the kind of measures through social assistance, tax finance measures that are put in place and rolled out. But what common lesson I think is important to bear in mind is that we have to make sure not to create parallel systems, to build on existing systems if they exist and expand them. And where they don't, I think we have to be very careful, even though things are done in a hurry and in a crisis situation, to at least be able to put in place some of the fundamentals so that whatever measures are put in place now can then be built on later and expanded and institutionalized, put in law, made sure to involve social dialogue as they're doing this, because that is also fundamental in the way in which countries are responding. So governments and social partners need to come together to have a kind of roadmap as they move forward. I think that's absolutely fundamental in the way in which social security and social protection systems are also put in place. So that dialogue element is really, really essential.
Sure, thank you very much. I think at this point in time, we've had some wonderful discussions, some great questions. I really appreciate and want to give a thanks to Shara Razavi, to Manuela Tomei, Sang-Hong Lee. I'm extremely grateful for your time, expertise that you've shared today in this discussion. For our participants, if you need any further information, please go to the ILO's website. Click on the COVID-19 portal where there is up-to-date information will be provided. As I mentioned earlier, the ILO is collecting responses from governments around the world and from our social partners, workers and employers about how we're addressing these problems, because we're in it together. We have to get through it together. As a part of the ILO Office for the United States overall engagement with key stakeholders, we'll be convening these regular discussions on key issues in the world of work on our World of Work collaborative learning platform, which will be launched in a few weeks. Just so you also know that there will be a webinar next week, which is being hosted by the Global Compact on the 7th of April. 3 speakers will be Guy Ryder, the Director General of the ILO, Roberto Suarez, the Secretary General of the International Organization of Employers, and Sharon Burrow, the General Secretary of the International Trade Union Confederation. The ILO also on the 8th of April will be holding a webinar which will focus on the ILO's work with young people and responses to COVID. So really interesting discussions coming up. Again, thank you to all our participants coming in here today. I'm very grateful for everybody spending the time with us. If you have any further questions, any ideas, or any questions, please send them to me, Cassidy@ilo.org, Cassidy. at ILO.org. We are very happy to be able to provide you with access to the information. Again, thank you very much to everyone, and I have to close this webinar for today. We hope to see you on the next occasion. Stay safe, stay healthy. We hope to see you soon. All the best.